City Talks with Reuben Abati.
Welcome to another edition of your number one talk show, City Talks with Reuben Abati, on your number one lifestyle station, City 105 on FM. On this show, we talk about issues of political and human interest that affect us as citizens of Nigeria and as members of the global human community. Today, we'll be discussing COVID-19 vaccination in Lagos State. And to guide us through this, really very lucky to have this very special guest today, Prof Akin Abayomi, Lagos State Commissioner. Professor Akin Abayomi is a Nigerian professor who specializes in internal medicine, hematology, environmental health, and biobanking. Studied at the Royal Medical College of St. Bartholomew's Hospital in the University of London, with fellowships from both Royal College of Medicine and Pathology in the United Kingdom and the College of Medicine in South Africa. He has worked in several countries across the world in internal medicine, hematology, and biosecurity. He was the chief pathologist and head of the division of hematology at the University of Stellenbosch Faculty of Medicine in Cape Town, South Africa. Professor Abayomi is the chair of the H3 Africa Consortium Data and Biospecimen Access Committee, principal investigator of the Global Emerging Pathogens Consortium, which was established at the height of the West African Ebola outbreak to address biosecurity concerns in Africa. Professor Abayomi is a member of the African Academy of Science Committee on Data Governance. He is also the lead consultant on the Biobank, Biosecurity, and Biodata Ebola rescue projects in Sierra Leone and Lagos, Nigeria. He was with the Nigerian Institute of Medical Research in Lagos when he was appointed commissioner by Governor Babajide Sanwo-Olu in 2019. Following the reported index case of COVID-19 in Lagos in March 2020, Professor Abayomi was appointed to lead the response against the virus in Africa's largest commercial city. Want to be part of this conversation, you can call us on 070-1051-1051 or leave comments on WhatsApp 09099164403 and on our social media accounts at City1051 on Zoom, Twitter, and Facebook on your number one lifestyle station, City 1051 FM. And I remain your host today, Reuben Abati, and our guest is Professor Abayomi, Lagos State Commissioner for Health. The subject is COVID-19 vaccination in Lagos State. Professor Abayomi, thank you very much for accepting to join us today on City Talks with Reuben Abati. Welcome. And first, let me start by congratulating you on the great work you've been doing with the public health system in Lagos. Very quickly, let me ask you, it's about 1 week now that we've had the vaccination program rollout in Lagos. I've talked about 8 immunization centers and 4 phases, and we've seen activities in some of those centers. What's the update? Where are we with the vaccination? What is the response like from the people?
Thank you, Reuben. And hello to all your listeners around Lagos and around the world. Yes, so as you know, we received our consignment from Abuja, from the COVAX Global Facility, and we were given just over 500,000 doses of AstraZeneca. The first thing was to set up the logistics to take it to our central cold chain stores in Ikeja and with backup in IDH. And then already Mr. Governor, as incident commander, had already anticipated the need for a vaccination roadmap. So we had inaugurated a Lagos State Vaccination Technical Working Group Committee, which had been working before the arrival of the vaccines to Lagos. So that once the vaccines hit Lagos State, we were able to quickly deploy it through our cold chain logistics, first to a central location and then to disperse it to our local government areas under very strict cold chain monitoring Lagos has got a very intricate network of vaccination logistics and personnel. So it's not something that was too difficult for us to do. So of course, Lagos is a complex place. So we were quickly able to set up 88 vaccination centers, but we flagged off, as you know, last Friday at Yaba, Lasuth, and FMC Ebutemeta, just to use one day to test the system and see what the uptake was going to be amongst our frontline workers and health professionals, to see what kind of adverse reactions we were going to see. So it's better to see adverse reactions inside a facility that has, sophisticated medical equipment and manpower to be able to deal with complications. We also just wanted to test the whole terrain and see how the whole plan would come together. So it was a very nice learning experience for us on that Friday. And as you know, Mr. Governor and Deputy Governor and some key members of cabinet came to observe that flag off. That went very well. And so from last Monday to yesterday, we've been vaccinating across the 88 centers. Every day we've picked up new things and we've been refining the process day by day. There have been quite a few challenges, but this is Lagos. So we always find a solution to every challenge.
Well, I don't know whether you want to talk about some of those challenges. For example, the immunization center that is around Falomo, some people have complained that there are long queues there, and that there's even reported cases of corruption, people having to pay to jump the queue, and that some people said there were too many Indians at that particular immunization center, and why should vaccine meant for Lagosians be given to Indians? I don't know whether you're aware.
Okay, well, let me first of all say that yes, I'm aware of all these issues. So first of all, we understand that there's going to be a heavy demand for vaccines in Lagos. And we had a very strict criteria according to the federal government phased rollout. But everybody's eager to get the vaccine. So let me say right up front that Lagosians should just be patient. We're going to vaccinate everybody over time. There's a global shortage of vaccines. So we're getting consignments that are part of the COVAX facility to ensure that there's global social equity in terms of distribution of the vaccines. But we're part of a global community. So let us be fair and let us realize that there are parts of the world that are under severe stress in terms of the number of people that are getting sick, the number of people that are dying. For example, in Lagos, throughout our entire outbreak of more than 12 months now, we've only lost under 500 people. Now, I know that sounds a little bit callous, but when you compare that to the millions of people that are dying around the world, I think Lagos has done extremely well. And, we must allow other communities to gain access as priority to these vaccines, while places like Nigeria and other sub-Saharan African countries, can be part of the global community to understand that there are urgencies, like in Brazil, in Europe, and in certain parts of the Americas. So we will get the vaccines. There's a shortage. More vaccines are coming through the pipeline. More vaccines are being validated by the WHO. So the shortage is easing off gradually. And as the shortage gradually eases off, we will get more consignments. And then, we plan to be vaccinating throughout this year of 2021 and into 2022. So I say that because there's been a rush in this week, and Lagosians have not followed the criteria that we have laid out in terms of those who qualify for phase 1. Now, whenever there's a rush, that will create an opportunity for people to take advantage of the situation. So we're very much informed about these events. We're putting things in place to make sure that nobody is taken advantage of. We're putting things in place to make sure that nobody can charge a Lagosian for any vaccination. It's supposed to be absolutely free at this point in time. The issue around Indians. So remember that, Lagos is a cosmopolitan city. Many Indians that live here are Nigerians. Many of them carry Nigerian passports, So if, there's a rush on the centers and Lagosians are disobeying the phased rollout that we are propagating and promulgating, and Indians who are part of the Lagos community are part of the Lagosians that are, not adhering to our criteria, we can't point a finger at Indians and particularly say, oh, Indians are not even Lagosians. They're part of the Lagos community. Yes, they may not qualify, but many other Lagosians who have been inundating our 88 centers are also Lagosians, and they are not following our strict criteria. So my word out there is to Lagosians, whoever you are, whether you're born in Lagos or you're a business person in Lagos, please just try and follow our criteria, because we don't want chaos at these centers. In time, we're going to vaccinate everybody that is due vaccination in Lagos. But, we have to follow the whole protocol, and it's a global protocol. And we're just trying to do it in a way that is sensible, that is devoid of chaos or breakdown of law and order.
Well, in a statement you issued a few days ago, you announced 2 portals where people can go and register. Well, some people are concerned that they don't get an acknowledgement and they're not given a date. Why is that so? And what steps do you take to correct that?
Yes, so those portals were developed by the federal government, and we had to take on those portals. I think that there was just generally an underestimate of the volume of traffic that was going to go through these portals. And so the portals were overloaded. And then, of course, the portals depend on the cell phone networks. So quite often, there might be a problem with the portal, and then there's a problem with connectivity. And when you combine these two, the portals were often down or slow or sluggish. We've been working very closely with the federal government to speed up these portals and change the server for Lagos. And also, we have servers and we have a portal in Lagos, but we don't want to complicate the situation at the moment. At the moment, we're using the federal portal and we're using federal servers, and we're going to use them until at some point we decide that maybe we just need to go a bit faster, and then we'll work with the federal IT specialists to maybe transition to a Lagos portal. But right now we're using the federal portal. It's getting better. I apologize to all Lagosians. These were technical difficulties beyond our control. But because of that, we've allowed walk-in registration. So people have been coming to the centers. And I think that has been contributing to some of the congestion at these centers, which is something that we really want to avoid, because we're trying to prevent COVID using a vaccine and not create a scenario where people are vulnerable to transmission of the virus by virtue of overcrowded vaccination centers. So, this was the first week. We've been able to address some of these challenges. This weekend, we're working around the clock to make sure, because we're not vaccinating on Saturdays and Sundays. So that gives the teams a lot of time to look back at the systems. We're rejigging the systems, and so that come Monday, we can hit the road running again with hopefully more efficient systems and better organization. So my apologies to Lagos if they've experienced any hitches along the way. It's a very logistically intense operation. It's almost like a census or like the NIN card registration. And we're hoping that we don't have that kind of scenario in Lagos. So we've deployed a lot of staff. We've got security agencies all over the place. We've got serious logistics. But this is a massive undertaking. So, there will be hiccups here and there. And with every day that's passing, the technical working group are on these issues and trying to smooth the path for Lagosians so that over the period of the rest of this year, we'll get the chance to vaccinate a significant proportion of Lagosians and build up that herd immunity that everybody is talking about. Thank you, Reuben.
Well, Prof, I also like you to address the issue of safety to the vaccine, particularly in the context of the politics and the controversy over the AstraZeneca vaccine. What have you seen in terms of response from the people in the last week? Is it a case of vaccine hesitancy or vaccine enthusiasm?
So we've seen a combination.
What does the data indicate?
Yes. Thank you, Reuben. We've seen a combination of vaccine hesitancy and we've seen vaccine rush. Lagos is an interesting place. Some people are bent on not having this vaccine and other people just can't wait to get the vaccine. So it's been an interesting week. The combination of hesitancy and rush, is something that we're trying to work on. The phased rollout is to vaccinate those that are vulnerable, which means our healthcare professionals and our essential personnel, and of course the port health, and then quickly move to the vulnerable members of community, those who are over the age of 60 or 70 with underlying conditions, because these are the most vulnerable people in the society. So we want to get on with this. So we've seen, as you said, the 88 sites were crowded, so obviously people are coming in, but we're still trying to work on the healthcare professionals to make sure that we get them all vaccinated and we disabuse their minds of the hesitancy that, that is going on around the social media. So, these vaccines have gone through extensive clinical trials through phase 1, phase 2, phase 3, and then the data around these trials is extremely complicated. And before WHO will accredit a vaccine or any other accreditation organization, scientists have sat down and mulled over this data to make sure that we're not taking any particular risks. So when we started to prepare to roll out the AstraZeneca, and almost the night before, we got this flurry of social media activity saying that AstraZeneca was responsible for excessive blood clotting and coagulation problems. The incident commander called an emergency meeting where we started to go into all the science once again, just to double check, looked at all the clinical trials. We presented, we have what's called the war cabinet, where we deal with emergency situations like this. And COVID has kept us on our feet because COVID is so dynamic. We almost have to change our policies and our strategies on a weekly basis. And we examined all the information and we felt that, the data, the scientific data, did not suggest that there was an excessive risk with administering AstraZeneca. So Mr. Governor gave us the permission to go ahead. Of course, we are liaising with the Nigerian Primary Healthcare Development Agency and the Nigerian Center for Disease Control and the WHO in Nigeria and across and the Africa Union. So we're not acting, on our own. We're acting within a global scientific network. And, the general consensus is that AstraZeneca, as are all the other ones that have been accredited, the benefit of getting the vaccine far outweighs the risk, And, in Lagos now, we vaccinated over 40,000 people in the last week. We've only seen the usual pain and swelling around the injection site with body pains, a bit of fever. Not many cases, something that Panadol or some anti-inflammatory will take care of, a good night's rest, and you'll be fine. We've had one or two faints or collapses, but that happens with all vaccinations. People are scared of the needle. There are some chemicals inside the vaccine that perhaps you react to, and that causes what's called a vasovagal attack or an anaphylactic shock. But all our personnel are trained. We have the adverse event kit, so we're able to immediately look after patients or vaccinees that have these symptoms. Nobody has developed a blood clot so far out of 40,000 people in Lagos. We have a research pillar within the technical working group, and they are monitoring cohorts of patients that are receiving this vaccine, because it was never trialed in this environment. So we are doing our own kind of research and trial just to follow patients up over time to see what kind of immunity you're developing from the vaccination. Is it as effective as they say it is? Are you developing any adverse events? There's a digital platform that we're using from NAFDAC and from WHO. So we're collecting all the data. We're doing research. Lagos is very data orientated, and we don't take anything for granted. We're doing our own research on our vaccination rollout program so that we can be informed about how we as Lagosians are responding to this vaccine. Thank you, Reuben.
Yes, Prof. Well, sometime in February, I think you announced that the Lagos State government was going to get its own supply of a vaccine outside the COVAX facility distribution coming from the federal government. Where are we with that? What's the assurance that by the time many of the people who are taking the vaccine now, by the time they are due for the second dose, that enough vaccines will be available from the federal government or from the one that the Lagos State government is trying to put?
Yes. So, I did mention that COVID is a dynamic situation. Things are changing from day to day, So we received 500,000 vaccines last week. The night before we're about to roll out, we get this flurry of information on the internet that, AstraZeneca is dangerous. So we have to hold it. Midnight, we're in the middle of a war cabinet meeting, trying to understand where this information is coming from. Why is it suddenly emerging on social media? What is the scientific data behind it? So before Lagos State, goes out to purchase its own vaccines, we're getting supplies from Federal. Federal have told us that there is another consignment coming. We're gaining experience. We're trying to understand. So for example, if we order 1 million doses of AstraZeneca or any other type of vaccine, and we don't particularly like it, or it's not working, in Lagos. So we are using this first phase, first of all, to understand how we are responding to the vaccine. Number two, see if it is efficacious in inducing an immunity in our people. Three, see if it is safe. And then obviously look at the logistics of the rollout in terms of how much does it cost. There's one thing to buy the vaccine, and there's another thing to distribute it and to administer it to Lagosians. Actually the logistics and the administration can be just as expensive as the vaccine itself, So we have to be careful about how we plan for the future. We've got this consignment. We're going to use this to understand the vaccine, to understand how our people, how ready are they for the vaccines, the social impact. We've got civil society working with us to understand, how are Lagosians thinking around this vaccine rollout plan. And when we get that understanding, then we'll mull through it. We'll refine our strategies, and then we'll move forward with a second phase, whether it's coming from the federal or whether it's coming from Lagos State. Time will tell. It will take us another few weeks to get through this phase one, and the federal assures us that there's more coming. So we're just going to wait, and as we've tried to reassure all Lagosians, Mr. Governor is telling us that we should relax. Everybody in Lagos is going to get the vaccine in due course, those that are obviously amenable to the vaccine. Thank you, Reuben.
Well, many people are under the impression that once they get vaccinated against COVID-19, that it will be a permanent immunity. But some other scientists have also said that this is not like polio immunization, not like tetanus or some other forms of immunization. The immunity phase may not last for more than 4 months or 5 months. There is no guarantee that the person cannot be reinfected. Please, if you could just help clarify that.
Yes. So, even with the natural infection, we were a bit surprised that after you got the natural infection, some people were getting second and third attacks of COVID, and we have several cases of that. So, COVID is a new virus, as we used to call it, is a novel pathogen. We're still trying, we have a lot more information around it, but it's quite curious that after you've caught COVID once, you can catch it second time or you can catch it a third time. So that's on the one side. So a natural infection will build your immunity if you're following the rules and the regulations or the laws around immunology. Similarly, a vaccine should build your immunity. Now, there are two different things. A vaccine is trying to convince your body that you've been exposed to the virus without getting sick. So both the natural infection and the vaccine will generate an immune response. It seems to us that they complement each other. So if, for example, you've had the natural infection and you get the vaccine, your immune system is boosted significantly. But if you've never had it before and you get the first dose of the vaccine, you get some level of immunity, and then you get your second dose, and that boosts your first dose. So we don't quite know. There might be multiple factors why people who have had the natural infection or who have had the COVID vaccine may still be vulnerable to the infection. It may be because the immunity doesn't last. It may be because the virus itself is changing. So the immunity that you built up 4 months ago to a vaccine or to a natural infection, 4 months later, you're faced with a variant of the virus, and in which case your immunity may work, but it may not be as robust as you think. So just like you get boosted for tetanus, so you may have had tetanus 4 years ago, you get an injury, you get a tetanus boost. Similarly, with viruses, because they change so readily, if coronavirus is still around towards the end of this year, or it comes seasonally, then it might be that we may need to boost the population with regular vaccines, depending on if the virus is mutating significantly enough for us to upgrade the vaccines. That happens in the flu, for example. If you live in the Northern Hemisphere and you know about the seasonal flu, you will know that every year you get a booster. And the reason for that is because the flu virus changes every year. So the vaccine you had in 2020 is not going to work in 2021 because the virus has changed, or another cousin of the virus has emerged. So we don't know. It's early times. We are doing the science, as I've said. But one thing is for sure, Reuben, if you've had COVID before, or if you've been vaccinated, even if you've just had one dose of the vaccine, it will protect you from a second exposure in terms of you not getting extremely unwell, becoming critically sick, and dying. So a past infection or even one dose of the vaccine will stop majority of people from getting severely ill from COVID and dying. And that's the whole objective. We may not be able to stop a mild infection, but we're certainly trying to stop people from dying from COVID. And that's the emphasis of the herd immunity and the vaccination campaign. It's not to say it will stop you from getting infection, but if you do, we want your immune system to be primed and ready for that infection so that you win the battle and the virus doesn't overcome your system and cause you to become severely sick and critically ill and possibly suffer fatality. Thanks.
During the National Immunization Program rollout, the boss of the NPHCDA, Professor Akin, one of the things he said is that they're going to attach vaccine accountability officers in the states. And only this week, we're also told that to ensure security, ICPC will also be involved. These were statements made at the federal level. Now, do we have persons, officers, whose responsibility is to ensure security for the vaccines and the storage chain, and also ensure accountability at the various immunization centers?
Yeah, that's a very important question, Reuben, because, so inside the technical working group, we have several members of cabinet, and one of the key members is the chief of staff, who is a security personnel himself. And he's working very closely with our security agencies to ensure that the vaccine is always accompanied by security agents. And there are a number of reasons why we need to do that. First of all, we need to account for each vial. So once a vial has been dispensed, we need to put that vial back in the inventory mechanism to make sure that it doesn't end up in a rubbish pile somewhere. Somebody takes the vial and fills it with normal saline or water and goes to sell it to Lagosians. So every time we consume the vaccine from the vial needs to go back, and then once it has been put through the accountability process, the vial is destroyed so that nobody can use an empty vial to deceive Lagosians. And this requires a lot of logistics and security. So we have several levels, and it's not just about security, it's obviously around cold chain. We need to keep these vaccines cool. So we have several levels of making sure that the vaccines never break their cold chain. We have about 3 levels. We have the Lagos State cold chain mechanism. We have the federal cold chain machinery, and we have engaged third party, to make sure that if there are any, breaks in the system, that these are picked up by neutral observers. And then we've engaged civil society, in terms of making sure that civil society are part of the process. And, you can't fool civil society. They're there, they're watching out, they're making sure we do what we say we'll do. They're picking up any lapses, and they're giving us feedback on the lapses so that we can refine the process. So it's very important for us to welcome civil society into this process to make sure that we as government are doing what we say we'll do. And even if there are any lapses, that those lapses are brought to our attention and we're addressing them as best we can. So we've got several levels of security, several levels of accountability, and several levels of cold chain monitoring mechanisms, just to make sure that we can account for everything, and that everything we deliver to our citizens is in keeping with international benchmark standards, and that we're not putting any Lagosians at risk, either by making corrupt practices possible, and ensuring that the vaccine itself maintains its integrity through our cold chain strategies. Thank you, Reuben.
Well, Prof, just one more question, and then we'll take a commercial break. And then when we come back, we will allow some of our listeners to also ask you questions or make comments. This question, if you can take it briefly. In the last 1 year, you've been very busy with COVID-19, setting up the centers, getting the vaccination process going, and all of that. How has that impacted on other issues of health concern in the state? Maternal health, for example, other communicable diseases, primary health care, and all of that, because it looks like, of course, has been strictly COVID-19.
Well, it appears like it has been strictly COVID-19, but that's not true. Mr. Governor, our incident commander, made a deliberate strategic move to make sure that there would be no collateral damage from the COVID-19 response. And, to do that, we've confined our COVID activity to just a handful of facilities. Of course, the nerve center is at Yaba. We deployed isolation facilities to Bagada and to near the airport. And then, as you know, we had a very robust partnership with private sector and philanthropy. So we were able to open up isolation centers across Lagos. But majority of our medical facilities, either primary or secondary, over 300 primary facilities, 27 general hospitals, our tertiary academic centers, our monospecialist facilities, all of them remained untouched by the COVID response. So our staff remained in their normal places. Our activities remained, even Mr. Governor, deployed increased resources to these facilities for a period of about 3 or 4 months during phase one. You remember that we had removed the tariffs for healthcare, across the primary and the secondary facilities. So instead of seeing a reduction in number of the patronage, we actually saw an increase. People were going to the facilities because care was free, and that was provided, courtesy of the incident commander, just in a deliberate effort to make sure that people were not dying from other things because we're spending all our time and resources on COVID-19. Yes, it was very busy for us in COVID, but we made sure to divide the response and to separate the response from the normal medical activity of the state, both at the primary, secondary, and tertiary levels. And we did that, I think, quite effectively. There was a time when people were scared to go to any hospital for a while. But I think we soon overcame that. And, we don't feel that we've suffered any collateral damage from COVID-19 in Lagos State.
Okay, on that note, Prof, we'll take a commercial break, and when we return, we'll take calls and comments. And if you want to be part of the row, 1051 1051. On WhatsApp, 09091 64403. And on Zoom, Twitter, and Facebook, you can reach us through at City 1051. So let's take this quick commercial break, and we'll return, and the conversation with Professor Akin Abayomi will continue.
City Talks with Reuben Abati.
Back to City Talks. Welcome back to City Talks with Reuben Abati on your #1 lifestyle station, City 1051 FM. Our guest is still the Honorable Commissioner for Health, Lagos, Professor Akin Abayomi. Prof, we're already having some reactions. Tosin Bakare here says, are there any arrangements for disabled, non-mobile people who can't leave their homes? Is there anything like home service in the immunization process?
You want to ask me a number of questions, or do you want me to take them one by one?
No, let's take them one by one.
So our primary healthcare facilities and our general hospitals are, not all of them are compliant with our disabled policy, but, we're doing the best we can at the moment. And obviously, as people come to the sites and we know that there is a disability in any of our patients, then our staff, whether it's delivery of vaccine or delivery of any kind of medical intervention, our staff are being trained in the new policies of addressing disabled members of the community. So I imagine that, we don't have infrastructure at the moment where we have this, wheelchair ramps in all our facilities, but as we design our new facilities, we're building, those kinds of components into our new blueprints for medical infrastructure across Lagos. So, we are doing the best we can for now. And of course, if you're disabled, you can call us ahead of time and we will try and make it possible for you to get your vaccine at the centers without you being unduly stressed.
Well, this other message is from Professor Kemi Rotimi, and it says, kudos to the indefatigable Honorable Commissioner for Health, Lagos, Professor Akin Abayomi. I predict a test waiting for you at the WHO in the near future. That's a compliment, Professor Kemi Rotimi. But do we have any callers on the line? Hello? If you want to be part of this conversation, you can join us on 0700 1051 1051.
Hello, Dr. Reuben Abati. Good afternoon, sir.
Hello, good afternoon.
Good afternoon, Dr. Reuben Abati.
Your name, your location, and please go ahead with your question.
Thank you very much. I'm calling from Ikeja. Number one, I appreciate the efforts of the governor and the professor is done so well for the past 1 year. But my question directly is, how is the state going to retain by sustaining the improved facility in the health ministry we have right now because of the contribution we have seen from the federal government and more money spent by the state government in improving the facilities of the state? Because COVID is around now, we're going to overcome this and more problems are still going to come in the future. That's number one. Number two, in the area of, social distancing, we saw how the government has been campaigning for social distancing, but now when we see government officials having events where this social gathering system is abusing that social distancing order, is it not, counterproductive when we see, for instance, the commissioning of the Adige Bridge, and again incidents that happened by when we were celebrating the late governor of Lagos State? There was no compliance with the social distancing order there. Good afternoon, sir.
Prof, over to you. Prof, you heard him. Hello, Professor Abayomi, are you still with us?
Yes, I'm here.
Yes, sir. He asked you 2 questions. Adam.
Yes. I think I got the gist. He was talking about how we're going to sustain the revamping of the medical health system in Lagos and the issue around social distancing and some of these public activities. So, Lagos State has put health as a top priority in terms of its capital, its human capital development strategy. So the cabinet are putting more and more funds into health. We are trying to change the way we are rolling out health in Lagos State. There are multiple strategies that we're deploying now to use our resources in a more efficient way, to join the digital age, to revamp our infrastructure so that we have a more conducive environment for our health professionals, make sure that we don't encourage them to leave our shores. We're putting more training in place. We're developing more sophisticated infrastructure. We're developing specialist facilities so that our Nigerian doctors have somewhere where they can practice and they can learn and they can go abroad and, look forward to coming back, to the state. So, Lagos State, has its own plan for increasing the amount of money that's pushed towards health. COVID has certainly opened our eyes, just like Ebola did, that Lagos State is a mega city, is very vulnerable to infectious diseases. There's a global pandemic going on at the moment, which is ravaging many mega cities where overcrowding is the norm. So for us in Lagos, if we take any lessons from Ebola and we take any lessons from COVID, which we have done, we take it very seriously. And we are trying, it's not just a health thing, it's a whole urban planning, environment, agriculture, security. So, it's not a vertical strategy, it's a horizontal strategy. And that's how the themes agenda was developed, so that we develop horizontal strategies with agencies working together across the board to solve, problems such as insecurity, such as vulnerability to biological threats. So Lagos, building a stronger health system. Of course, we have numerous developmental partners that work with us. And of course, we take our lead from the federal government, but Lagos is unique. So we take the lead and we refine it and we adapt it to our unique environment in Lagos. Now, talking about social distancing, I think the future in COVID and post-COVID, life will never be the same again. People are more cognizant of what personal space is all about. People are cognizant of respiratory contagions. People are cognizant of personal hygiene. So, what COVID has taught us is that it's important to maintain and respect personal space and the distance between human beings, and avoid practices that puts you at risk of being affected by a contagion. It's almost impossible in Lagos to organize a public activity without a crowd trying to develop around that activity. We try and put as much security in place, but Lagosians being Lagosians, it will always be a Lagos type of crowd. We try to keep things short. We don't want to disconnect from the community completely. We want to be back in the community, but obviously we want to respect the social distancing laws that we ourselves are promoting. So, I know sometimes it looks like it's a bit chaotic at some of these events, but we certainly are cognizant of the situation, and we're putting things in place as best we can to ensure that while we're in the era of COVID, that we maintain the social distancing laws. We've just come out of second wave in Lagos. So we are in relaxed mode again, but we're not taking anything for granted. We're preparing. Many countries have gone into third wave or even fourth waves. We don't know what variants around the corner. We're gathering intelligence. We're building up. We're not slowing down. We're actually ramping up our preparation. If we don't need it, fine. But if we need it, at least we'll be prepared. So that's what's happening in Lagos.
Well, Prof, 2 quick questions. Please ask the commissioner, what plans do they have for old age citizens of Lagos, persons who are over 60 and above? And if they have plans, do they have records or data to guide them as to how to administer the vaccine to those old people? That is one. I see Abiba Unite's hand up right there on Zoom. Abiba Unite, if you may just go ahead with your question or comment. No, Abiba Unite. Okay, while we're waiting for Abiba Unite to...
Hello,
okay.
Good afternoon.
Good afternoon,
Hello.
yes.
Good afternoon.
Please go ahead.
Yes. Kudos to our commissioner and the host. Please, I just want to ask, is there any age limit to the vaccine? I want to ask, and then there's this second question: if you have a measles and then you want to take the vaccine, is it advisable for you to take the vaccine with the myth we have that if you have a measles, you are not supposed to take any injection? I just want a clarification on that. Hello, are you hearing me?
Yes, we heard you. Thank you.
Yes, thank you, sir.
The first question was around what plans do we have for the elderly in Lagos? So if you notice that we've even revised our phase 1 to include persons over the age of 70. So we've added adult mature citizens of Lagos. If you're over the age of 70 and you come to any of our centers, we will accept you for vaccination alongside the essential workers, so that, because we believe that these are the most vulnerable in society, those people who come across a lot of people on a daily basis by virtue of their profession, and then of course the elderly, especially if they have underlying comorbidities like hypertension or diabetes. So we're taking that into consideration to make sure that the most vulnerable of Lagos are addressed in the first phase and phase 2. Then regarding the age limit, the only age limit is that we're not vaccinating anybody under the age of 18, because we haven't run globally any clinical trials on children. So we don't know how children will react to this vaccine. And so, and generally speaking, young people are very resilient to COVID-19. So, all the deaths that we've experienced are in more mature people. Children catch COVID and very few of them get unwell. Most of them are asymptomatic or mild. So we're not worried about young people. We're just worried about mature people, and especially people who have underlying conditions, and of course our health personnel. We want to protect them because they're coming across people every day with possible COVID, and we certainly have a shortage of medical personnel. We don't want our doctors and our health professionals to get sick and die. As with all vaccines, if you have an ongoing infection with anything, so whether you've got a flu or you've got measles or you've got any kind of infection, it's not advisable to take a vaccine during that period of time. So the vaccines will always be available. So if you're unwell at the moment, try not to take the vaccine, because we don't know how your body will respond to a vaccine on top of an ongoing infection. So, get well from whatever you have at the moment. And when you're better and fully recovered, then you can present yourself for the COVID vaccine. We don't want a situation where, two things are going on in your body at the same time and you develop complications, and we're trying to stop you from getting unwell. So we don't want to put our citizens at risk. So if you're unwell, just wait till you're feeling better before you present yourself for the vaccine.
Do we have another caller on the line out there who would like to be part of this? Hello? Hello, do we have another caller?
Hello.
Yes, please go ahead. Your name, your location, and please be brief. Oh, we lost that caller. Well, AA, I see his hand up on the screen. AA, if you may just go ahead. Briefly, because we have just a few minutes.
Yes, good afternoon, Mr. Yes, good afternoon, Mr. Abati.
Good afternoon.
Honorable Commissioner, good afternoon, sir. And I'd first like to commend you on a job well done. It's quite impressive. I took my vaccination yesterday at the Oregon Center close to my house. And my only observation was, well, my fear, so to speak, is for when I'm going to take the second dose. That's in June, on June the 16th. Now, the center is such a small place, and I noticed we were not really observing COVID protocols. We all sat next to each other, one. And two, I'm beginning to wonder, when we're going to take the second dose, are you going to put all first dose people with second dose people, or there'll be some centers designated for second doses alone? Because as at Friday, the place was quite full, if I must say that. It was quite full. Thank you very much. Well done. We appreciate your efforts.
Thank you very much. So yes, the question around the second dose. So I don't know if you've had COVID before. So if you've had COVID before, the science tells us that one dose may just be enough for you. And the science shows that your immune system will be boosted at least 100-fold by taking a vaccine after you've had a natural infection. But if you don't know that you've had a natural infection and you're just following the routine, the second dose should come up before 12 weeks. They say the science suggests that the longer you leave it up to 12 weeks, the more robust immunity you will get from a second dose. So we have up till 12 weeks to deliver the second dose. In the second phase, after we've exhausted this phase, we are probably going to roll out more centers. We had originally planned to roll out about 200 centers, but the logistics was quite immense for Lagos State. So we believe that in the second phase, we will have a lot more centers. We're paying attention to crowding, which is why the digital platform should have helped us to sift people, to make sure that only people who have appointments are coming to these facilities. And then once the facility for that day is exhausted in terms of numbers per facility, that it doesn't allow you to book that facility for that particular day. So I told you we're having problems with the platform from Abuja, but we're getting over it. This weekend, we're working very hard on it to make sure it works. If it doesn't become fully active next week, we have a backup plan for that, so that we can make sure that there's spacing at these facilities and people don't come at the same time. I think the crowding occurs when people walk into a facility, they're all walking around 10 or 11. And so if you go there at those times, you will find a bit of congestion. So we're very keen that congestion is not part of the vaccination rollout, because again, as you rightly alluded to, that will create an opportunity for the virus to have the opportunity to spread from person to person. So in the second phase, when you come for your second dose, we hope we would have deployed more centers. We're paying attention to social distancing and the space between people. We're paying attention to the digital platform to make sure that you come in at a time
Prof,
when...
I would like to thank you very much. I know you have
Yes.
other engagements.
Yeah, you come in at a time that's designated for you and that there's no crowding at the facilities. Thank you. Reuben, are you still there? You're on mute, by the way.
With Reuben Abati on City 105.1 FM.
Please note, the views and opinions expressed in the course of this program do not represent that of City 105.1 FM. The station, therefore, is not liable to any legal action that may result from the program.
We're going to improve our digital platform to make sure that people can book a center that's closest to where they live at a time that's spaced out, so that when you get there, you will only find a handful of people at any particular time. There will be a restricted numbers per center depending on the facility itself and the size of the facility, so that we don't run into a situation where we have overcrowding and exposing people to the opportunity for transmission of the virus. The second dose, as I said, if you've had the natural infection before and you have your first dose, it will boost you significantly. Of course, you can have your second dose as well, but just so that you know that a natural infection plus the first vaccination gives you a very high level of immunity to the virus, to subsequent exposure to the virus. So Reuben, are you back yet, or should I just carry on?
Well, no, I was saying that we've already run out of time, and I was thanking you very much for your time. I know you have other engagements, but we're so excited, so glad that you were able to be with us and share so many insights. And I would like to thank all our listeners and viewers and everyone who participated by all the various platforms. For those of you who tuned to our YouTube page, CT 1051, to watch the entire show, and don't forget to hit the subscription button. And don't forget also to tune in next week at noon for another exciting edition of City Talks. My name is Reuben Abati. The show was produced by Adedoja Allen, Abiodun Odun, Ayodamola Oludara, Oluwaseun Adetuntun, and Ulanrewaju Unikwede Jr. Thank you very much. Have a grateful weekend and join us again next Saturday. Thank you.
City Talks with Reuben Abati.